So we will be celebrating National Eye Donation Fortnight for the year 2025. And the topic we have chosen today is expanding the role of eye donations and advances in corneal transplantation. And our guest is Dr. Ashok Sharma. He's Director, Cornea Center, founder and honorary secretary, Eye Bank Society of Chandigarh. And I'm the host, Dr. Rakesh Gupta, and I'm President and Director of Public Health, Strategic Institute for Public Health Education and Research. So, National Eye Donation Fortnight is observed every year in India to raise the awareness about eye donation and to encourage people to pledge their eyes, helping reduce corneal blindness. More than 4.6 million people in India they suffer from corneal blindness, many of them young. With the modern surgical advancement, the cornea can be divided into distinct layers. This allows single cornea to be used for multiple patients, potentially benefiting up to 5 people from one eye. So, Dr. Shok will tell you in detail about this. Anyone above 18 years can pledge their eyes by registering with an eye bank, NGO, or hospital. And it is important to inform family members of this noble decision. I think this is more important that you discuss with the family members about your decision. By donating eyes, we can give the gift of sight, improve quality of life, and truly live beyond our lifetime. In most cases, a pair of donated eyes can restore vision to 2 people, as the cornea with each eye can be transplanted individually. However, advancements in surgical technique may allow a single eye to be used for multiple recipients, meaning a pair of eyes can help many more people for donating your eyes, many more people. For donating your eyes online, please click at the link. I've shared the link in the chat box as well. So now we can take a pledge that I give my eyes for the purpose of transplantation, for medical research or education. I further direct my next of kin herein named to execute the gift after my death. So this is a pledge you must always take during this fortnight at least. And I may tell you that even when you fill up the form for the driving lessons, you have to fill this pledge. Or you can even refuse it, but most of the people they say yes to the pledge. So can you just switch on your video so that we can have a good snapshot of all? Can you please switch on the videos, video cameras? All may please switch on the video cameras. Okay, Dr. Ashok, you can please share your PowerPoint.
Okay.
Yeah, it is visible. So make it in the slideshow, but yeah, yeah, this is okay.
Good evening, everybody. At the outset, I would like to thank Dr. Rakesh Gupta, President Sipher, for allowing me to celebrate National Fortnight on eye donation and share my experience on eye donation and corneal transplant. We know that blindness is horrifying. And if we want to have an experience, let's just close our eyes for 2 minutes and one becomes impatient and it's not possible to tolerate beyond that. So imagine a person who has to live his whole life in this dark and has to maintain himself or his family with that. So there are so many people who are living this life, and we need to do something for this. So in this presentation, I will be discussing all these issues related to the blindness, corneal blindness, what is the remedy, how is our eye donation done, who can do, who cannot do, and what is eye banking, how to maintain the quality and standards of eye banking, what is corneal transplantation, who can get benefit, and how a community can contribute to it. Now, coming to the blindness statistics, all over the world, 50 million people are blind. And out of those 15 million, 10 million people are in our country alone. And if we look at the corneal blindness, worldwide, 8 million people are blind due to corneal diseases, and of these, 1.1 million are in India alone. If we look at the causes of the blindness, cataract, refractive error, retinal disease, glaucoma, corneal diseases, all these are etiologies for blindness. So any of these diseases can cause blindness, but today we will be restricting our discussion to mainly the corneal blindness. And if we discuss corneal blindness, we know that any infection on the cornea, whether it is bacterial, viral, or fungal, chemical injuries, which can be mechanical or chemical, these can cause blindness. After surgery, corneal edema, or due to various diseases, they can cause edema, they can cause blindness. Corneal degenerations, nutritional deficiencies, and congenital corneal opacities are some of the other causes which can also cause to the loss of transparency of the cornea, and finally to the blind. And if we look at the magnitude of the corneal blindness in India, 1.1 million people are blind because of corneal disease in India, and most of these are young and children and adults. And almost 30 to 40,000 new cases are added every year. So burden of corneal blindness is huge, and we need to do something about it. Now, if we look at the remedy, whatever is the cause of the corneal blindness, the solution is only one, and that is corneal grafting. Believe me, this surgery is just like a magic. Like if you are just like lifting a curtain. You can see the above picture where the cornea is opaque and light is not entering into the eye, so the person is not seeing. And below we have the same eye where the corneal transplant has been done and the patient sees. So it's just like a miracle, and this can happen if we donate the eyes. But the question is that if the surgery is that successful, why it is restricted, or why the numbers are not that we eliminate the corneal blindness? The reason for this is that the cornea at present is not synthetically manufactured, and neither it is commercially available. So the only source of cornea is through eye donation, and that too after the person has lived his life beautifully, and if he donate his eyes, then only we can make the other person see. So that is the importance of the eye donation. In an estimate, and that is most often said by Professor G. Rao, who is the founder of LV Prasad Institute. According to him, at least 1 lakh good quality corneas in India are required if we want to eliminate blindness in coming few years. But the problem is that the number of eyes available or which we can procure are much less than that. Right at the moment, we are able to procure something like 37,000 eyes. That is the statistics given by EBAI. And that also, out of those, only 50% they can be utilized to give eyesight to the corneal blind people. So there is a huge disparity between the demand and the supply. Demand is too much and the supply is too meager. If we look at the North India where we are residing, the various surveys done, they have shown that the rate of corneal blindness in northern states are much higher compared to the others. But if we look at the eye donation, you can see the number of eyes donated in this season are much less compared to the other areas of our country. So at this fortnight, we should make efforts to enhance the procurement of the donor eyes. We should come forward, we should pledge, and we should also help in actual procurement of the donor eyes. I have spent almost 18 years in PGI since 1985. So we started with scratch and we passed through all the stages that we have to make people aware of eye donation. And right at the moment, at least in Chandigarh, we are happy that people are much more aware. We used to do various lectures, press conferences on social media, TVs, lectures, awareness programs, then slogan writing, painting competitions. All these are necessary to create awareness among the people so that people can donate eyes. There are many myths which are associated with the eye donation. And most of the people, they think that if the eyes are donated, there may be disfigurement of the face, which is not true. Because whenever the surgery is done, it is just like done as if it is done in the operation theater, giving due respect to the deceased body. And we always put the, if we are removing whole globe, we are putting the prosthetic device which resembles the shape of the eye. Or if we are just moving the cornea, then we are putting the disc so that resembles the artificial cornea, artificial eye basically. So there is no disfigurement of the face. There is no delay in the funeral because it just take only 20 minutes, and there is no need for to take the body to the hospital. The IBank team just comes to the native place of the deceased, and the procurement of the donor eyes is done there only. There is another myth that only those people who have pledged their eyes they can donate, which is again untrue, because anybody can donate even if he has not pledged. Only thing is the family members, they need to give consent at the time of the retrieval of the cornea. So if we look at other causes why there is shortage of donor cornea and why we are not able to meet the targets, there is a lack of awareness of organ donation among the public at large, lack of community participation, people shrug off their social responsibility. There is sometimes a lack of coordination between the medical personnel. That person wants to donate the eyes but is not able to contact the right person. Difficulty in motivating the family members when they are in grief. And then the laws are also sometimes not favorable. I will give an example that sometimes what happens is that in a medical legal case, young person dies in a road accident, but the problem is that the body is in the police custody and police has to say yes, and then only eyes can be donated. So there are in several states police commissioners, they have given the permission, and they give permission that in case the eyes are not required for the post-mortem examination or for medical legal purposes, then the eyes can be donated, and that is welcome, and more eyes are donated from young people who die of accidents. Sometimes the religion also is cited as a reason, but believe me, there is no religion which says against the eye donation. All religions, they support, approve, and consider eye donation as the supreme form of gift. There is heartening news that in Madhya Pradesh, Nimach, there is a highest number of eye donations per capita eye donation. And this is also known as eye donation capital of India. So this is very heartening, and others also should take a lesson from this venture. Anyone can donate eyes. Sometimes people they feel that if they are using glasses, they are very old or very young, and people who have undergone eye surgeries, persons who are having diabetes or hypertension, they cannot donate eyes. It's not like that. Anybody can donate eyes, and the reason is that we will be using only cornea, not the other parts of the eye. And only those people who are like who have died of infectious diseases like hepatitis B, hepatitis C, AIDS, septicemia, or tetanus. These are some of the diseases where the eyes are not like possible to be retrieved and used for corneal transplant. Again, that's due to the advanced cancer or blood cancer, and that's due to unknown viral encephalitis, etc. These are some of the diseases where there is always a significant risk that the disease may be transmitted to the recipient. So that is the reason the eyes from these donors, they are not like retrieved. Uh, there are some other truths about the eye donation which should we should know, and we should dispel that, and some of the information we should know. Most of the people they ask that after how much time after death we can like retrieve the eyes. Preferably it should be within 8 hours, but eye banks usually do not say no even if the duration is more than that. And again, sometimes people ask that what amount of blood is collected from the donor. Again, this is to screen the donor for the infectious diseases to prevent any transmission of the contagious disease from donor to the recipient. Uh, Sometimes if question is asked that whether it is essential to give family members consent, yes, this is definitely required. And whosoever pledges his eyes should make his family members aware that he has make such a wish, and after his demise, if situation arises, my eyes should be donated. And I would suggest that it will be better if a whole family pledges eyes and donates eyes, so that everybody is aware of the wish of the person, each other's. And again, it's essential to have. It's not essential to have the pledge card to donate eyes. Again, we have one misconception with the community sometimes, that if we want to donate eyes, it's a great hassle that the body may need to be shifted to hospital to make an eye donation. No, it's not like that. There is no need to shift the body to any other place. Only at the native place of the deceased, the eye bank team arrives, and they retrieve the eyes as they do in the hospital. Wherever the body is there, whether it is there in the hospital or it is in the, even sometimes in the like mortuary or at the native place of the deceased. Again, sometimes it's asked that all corneas collected are suitable for transplantation. No, it's not like that. All eyes which we collect in these are evaluated in the eye bank on slit lamp examination, and also on the specular microscopy to determine the number of the cells per millimeter square the cornea is having. Only those corneas which are suitable for transplant, they are used for corneal transplant. Uh, Again, there is one problem. It's both ways. Sometimes the donor family, they want to know whether they want address from the hospital or eye bank to whom the eyes have been given, and sometimes the recipient want to know. So it should be very clear that who the family, once they are making the donations, it should be anonymous. They have no right to know whom the eyes have been transplanted. And similarly, the recipient also doesn't need to know whom from whom which donor the eyes have come, because this can create a lot of problems. And this is again a code of ethics which is followed throughout the world. And people are very emotional. They are after sometimes eye bank people to know this, but I'm of the opinion that this should never be disclosed. Although I have seen some at some places this is being done to promote the eye donation, but I'm not very happy with that. Again, a situation when the eye donation call comes, what to do? And once a call comes, the procurement activities they start. Once anybody receives call in the eye bank, They note down the name, age of the donor, time of the death, cause of the death, exact address, telephone, and I'll also will advise that they should note down the phone number of a contact person to whom they can contact when they are going to unknown place, or they have to make phone call to find out the way and all that. So this is very important. And in addition, if they can ask the family members to switch off the fans, and they should like switch on air conditioner if they are running, or and also if they can put wet cotton or some ice packs over the donor eyes, then it will help at least, because then the eyes viability or corneal endothelial cells viability can be prolonged. Uh, Again, once the call is there, then the iBank team leaves within 5 minutes, as short as the short possible time. And once they reach the place, they obtain the written consent, and then the retrieval of the like if they are removing the whole globe, or if they are removing the only the donor cornea, it's done under all aseptic measures. And again, as we discussed, 10 ml of blood sample is taken, and the tissue which is procured is placed in the ice box, and that is carried back to the eye bank, basically. And all due respect is given to the body. No disfigurement of the face is there. And the eye bank people, they clean the place and the face of the deceased before they leave the place, and they proceed to the eye bank. Now, once we are at iBank, we know that iBank has several functions. It creates a public awareness, donor cornea procurement, as we discussed, then the evaluation, corneal donor cornea storage, and then finally the corneal distribution to the surgeons. So all these functions are done by the iBank, and the further activities will be done in the iBank. So without going into the more details, I would just like to mention that sometimes the eye banks are started with a great enthusiasm, but then the quality is not maintained due to some reasons. So I would advise that these are some of the indicators: adverse reaction rate, discard rate, protocol deviation rate, compliance rate. So it's always necessary for the iBank to follow the standardized protocols, and to have better trained people, and give them regular training, or regular CME's participation, so that they know what is happening in the latest situation. Again, effective quality assurance program should be there, and improved public awareness program should be there. If the quality is not maintained due to lack of adopting the policies, what happens is that the donor tissue, the surgeon get may be contaminated. There will be more number of the failed grafts, and the reduced utility of the donor corneas. And I have seen that some of the eye banks which were started with the great enthusiasm, they did not follow the quality control programs in their eye banks, and finally they had to be closed down. So that is very important. Now, whenever we talk of awareness programs, we have two types of donor cornea retrieval programs. One is we get eye donations from the voluntary donations, and the second area, which is much more important, is the hospital corneal retrieval program. Now, in this one, basically, we have grief counselors, and these grief counselors, they do two activities. One is they do the grief counseling. At the same time, they motivate the family members for eye donation. The advantage of the hospital cornea retrieval program is that the medical history of the donor is readily available to the eye bank personnel, and he can make assessment whether the eyes can be used or not. Then we get tissues from the younger donors, and there is a very less time interval between death to cornea retrieval time. So both cornea collection and utilization rates, they are much higher. So HRP enhances both procurement as well as the quality of the donor corneas. and that way we can get better results of the corneal transplantation. So I would advise all the eye banks to follow this program and to get MOU with the hospitals so that they can retrieve the cornea through this hospital cornea retrieval program, and they can get better eyes and better quality donor corneas. Now, these are some of the screening tests done before the utility or before the use of the donor corneas: HIV, HBsAg, and then syphilis, HCV. All these tests are done before the tissue is distributed. So after eye donation, now we will come to the corneal grafting area. As we discussed that this is one surgery which is just like a magic, and it improves eyesight instantaneously. So I will cite some examples where it has not only improved eyesight, but it has also given life to the person. This person was blind. He is from my native place near Nangal, and his other eye was almost no perception of light due to glaucoma. So in 2004, his son brought him to me, saying that he's my father, and my father has made 4 attempts to commit suicide. Now you can imagine, he wanted to jump into the Nangal Hydal channel and end his life because he was not seeing with the other eye due to the cornea problem. One eye was lost because of glaucoma. So after in 2004, we did corneal transplants for him. He was seeing with this eye, and he's also seeing right at the moment also. So you can see that after even 21 years, this person is seeing. So corneal grafting is not only like sight saving, but it is life saving. So act of donation can save even the life of the person. This person was like poor. He was brought to me by one of the NGO society member, and we did his corneal transplant again. This was done in 2003, and this is now 22 years after the surgery. He is enjoying good vision. This is what happens if you maintain the quality of the donor tissue. If your donor quality is not up to the mark, your graft is bound to fail after a year, 6 months, or 2 years. So this gives a lot of satisfaction once we do high quality grafts. Now, this is another person whom we did pentating keratoplasty, and his eye was not seeing for 50 years. And once we did corneal grafting, he was excited. He said, "I am seeing with this eye after 50 years." So, if it is not a child, say below 8 or 9 years, then even the after such a gap of 50 years, also we can give eyesight to the person with the corneal transplant. Right at the moment, we know that cornea has 5 layers, and all the layers they serve different functions. So we can instead of doing full thickness penetrating graft, we can do lamellar graft. So whichever layer is defective, we can replace that. We can also do cultured limbal stem cell transplants, taking stem cells from the limbus and doing all lamellar surgeries, both deep anterior lamellar keratoplasty, DSEC and DMEC. So that is what Dr. Rakesh Gupta also mentioned in the beginning, that nowadays it is not that one donor will give eyesight to 2 people. It can give to multiple people because we can use for different surgeries. So this is one surgery, deep anterior lamellar keratoplasty, and this has advantage that we are not touching the endothelium and the Descemet's membrane. Therefore, the risk of graft rejection is less, and we use less steroids. So all the complications which are occurring in penetrating keratoplasty are less in number in these cases. And this surgery is very rewarding for patients from our country, where the weather is such that there may be humid environment, and the corneal transplant may get infected. So DALK is very paying surgery and very effective surgery, and long-lasting sight. So this is another surgery which I was discussing, that is the endothelial keratoplasty or DSEC, in which we just remove the Descemet's membrane and endothelial cells, and we replace it with the stromal tissue, which contains Descemet's membrane also and healthy endothelial cells. and this can be done for pseudophakic corneal edema, Fuchs endothelial dystrophy, and there is no need to put sutures. You can see the cornea below, lower down picture. Surgery has been done, but there are no stitches on the cornea. So this is the advantage of this surgery, and the eyesight is gained properly. There is no wound on the cornea. That is the biggest advantage. So this lady I would definitely like to mention. She was basically a very old lady, and she had chronic rheumatoid arthritis, very severe dry eye disease, and it was not possible to rehabilitate this patient by performing corneal transplant, that is the full thickness transplant. So what we did for her was that since she was not seeing and she was deaf, so we operated her under general anesthesia basically, and we did DSEP for her, and she is seeing with this eye, and the results are very gratifying. So before going further, I would just like to show one small video of which in which we are showing that the children, they can be.
Corneal blindness is an evil to mankind, and we need to battle it. Let's do it. Not this way. We need to pledge and donate eyes and perform corneal graft.
Penetrating keratoplasty in the eye with microophthalmia, microcornea, sclerocornea, and opaque cornea.
The corneal diameter was 8.5 and 8.0 millimeters. 6.0 millimeters corneal trephine was selected and partial corneal trephination was done. The anterior chamber was entered and the host cornea was excised. The child had been given intravenous mannitol and hyperventilated, therefore we did not encounter intraoperative positive pressure. The donor corneal button 0, 5 mm oversized was sutured using 10-0 nylon interrupted sutures. The child underwent surgery in the left eye 5 months later. She had one episode of graft rejection that was successfully treated. The child has started going to school and is able to read and play with her friends. She is able to take part in extracurricular activities. There are many success stories similar to these.
Great achievement. We have won the battle.
So the results of corneal transplants, although in children, the surgical technique itself is difficult and it needs meticulous follow-up, but the results are gratifying and you are rewarded. And when we presented our poster in the American Academy, we got the Best Poster Award also for pediatric corneal transplants. So in the end, I would again like to say that let's pledge our eyes on this day and make our fellow citizens to see, those who are not able to see because of corneal blindness. Thank you all for attention, and I again thank Dr. Rakesh Gupta for giving me opportunity. Thank you, Dr. Rakesh Gupta ji.
Thank you, Dr. Ashok Sharma, for a very wonderful presentation. And I think it will be very helpful for general ophthalmologists as well as public health students. So thanks a lot. And I may tell you that Dr. Ashok Sharma was awarded by Sipher as a cornea hero because he has been doing this job of cornea donation and cornea transplant since long, almost 3 decades now. So
yeah, it's almost 40 years.
48 years. So that's a long
40
time.
years, 40, 85 to 2025, 40
Okay.
years.
Thank you.
Yeah.
So he told you about the causes of the blindness, then why there is a shortage of the corneal tissue. And I may correct myself that there are about 1.2 million corneal blind in India, and only we get 37,000 corneal tissue. And there are some myths related to the eye donation. and we need to bust those myths. That person is born without eyes, and also I may tell you that there's no disfigurement after the corneal donation.
Oh, yeah.
And why there's shortage of cornea? So he told us, and there's no religion which bans eye donations. And who can donate eyes? He tells that some of the infectious diseases like hepatitis, septicemia. So we don't take eyes of such patients. Blood cancers, death due to unknown causes. We normally avoid taking the, the corneal tissue. And the blood of donor is taken. 10 ml of blood is to screen for any diseases, such diseases. And and he just asks you that is it essential to have a pledge card? So no, it is not required to have a pledge card. You must discuss within the family. It is better. And as Dr. Ashok Sharma has advised that whole of the family should donate eyes together. And nowadays, as I told you, that even when you fill up a driving license form, you have to tell them that whether you want to donate organs or not. So he told about the hospital cornea retrieval program. So we get young donors and lesser tissue is wasted. So utilization rate is better. And some lives have been saved. He just gave you instance and how life was saved actually. And there are different types. He also told about the different types of the surgeries like pentatene keratoplasty, DLK, DSAEK. And he also showed you the video of the live surgery of a child. So thanks a lot. And we are open for the discussion, or you can share your questions in the chat box. We'll send it to Dr. Ashok Sharma for answers through email. So the forum is open for any questions. Yes, Bhutia, do you have any question? So Dr. Ashok Sharma did a very good presentation and it was very simple to understand. So maybe there are no questions at present, but if you have any question, you can just put them in the mailbox or in the chat box, and just I'll share with Dr. Ashok Sharma. So thanks a lot, Dr. Ashok, and
Thank you so much.
yeah, and thank you all participants for being a good listener. And I am hopeful that all will benefit from the presentation. Thank you. Thank you. Thanks a lot. Bye.
Thank you.